Okay, when I worked on my book, The Autistic Brain, with Richard Panik, really fabulous science writer, we went through all the DSMs and laid out the entire history of the diagnosis. And it was kind of shocking to see how much it had changed over the years. I knew it had changed, but I'd never seen it all laid out where I could just read it all together. 1943, Leo Kanner did his famous paper. In fact, there's a guy named Triplett who was one of his original patients. He still is a bank teller and plays golf. And in 1950 and 1970, went through all the horrible blaming of parents, all that horrible psychoanalytic rubbish, just absolute rubbish. In 1952, they listed autism along with schizophrenia. They had those mixed up in children. Then in 1968, they only mentioned autism. They almost left it out. I go, wait a minute, this is supposed to be science? I think the problem we got here is it's maybe half science, and the other half is doctors fighting around conference room tables arguing. In 1980, that's when they actually got a behavioral profile that made some sense. You had to have onset under 30 months, and you had to have definite speech abnormalities, either delayed speech or definite abnormal speech, along with the autistic behavior. And then in 87, they added the PDD-NOS, evasive developmental disorder, not otherwise specified. I don't even know what that means. Then in 1994, they added Asperger's syndrome. So now, every geek and nerd in Silicon Valley could be on this, because this is a kid that has no obvious speech delay. And I had obvious speech delay. I was not fully verbal until I was 4, and fortunately I had very, very good early educational intervention, and my original diagnosis, because I didn't know much about autism back then, was brain damage. But I had classical autistic symptoms. What worries me now, especially some of these Asperger kids, is I work in a technical field. So I go out to a meat plant, or I go give a talk out in Silicon Valley, and there's undiagnosed Asperger's. They're all over, everywhere, in good jobs that they've kept. Because most of those kids, when they were 12, had paper routes, and they learned work skills. I get really concerned now, and I'm seeing too many of them getting addicted to video games, not having learned any work skills. I think a lot of these kids, when they're 12 years old, the best thing they could do is have a paper route. They've got to learn the discipline of work. And if there's no paper routes, then set up walking dogs for the neighbors. I'm seeing too many kids that haven't learned how to shake hands, haven't learned how to shop. It's sort of like, okay, they got a diagnosis. They go, poor little Jimmy, he will order his donut for him at Tim Hortons. I go, no, you're going to have to go up there and get your own donut, or you're not going to have one. My mother had a really good sense of just how hard to push me. You got to stretch these kids. You got to stretch them just outside the comfort zone, or they're not going to develop. She was always getting me exposed to new things, because if I hadn't gone to my aunt's ranch, I wouldn't have gotten interested in beef cattle. You've got to expose kids to interesting things to get them interested in interesting things that could turn into a career. And then in 2013, they made everything ASD now. And I'm starting to hear more as I travel around ASD, taking the Asperger out, and how this is going to affect services. I could have to talk more about the U.S. than here. There's a lot of variation between the different states, and there's variation here.